say, for example, we have a patient that is perfectly healthy. They have no problems with ED. But that might be something that is a concern for them in the future. What would you recommend to them to do in terms of lifestyle measures to make sure that they're in optimal health and then they're preventing themselves from developing erectile dysfunction in the future?
Well, there's very good evidence that losing weight improves erections.
So stay active, stay fit.
Stay active, eat healthily, keep the fat off, because as we've said, the fat is metabolically active and will not only lower your testosterone level, but it'll be associated with the inflammatory components that can affect our arteries. And so that's a good general health measure. But there are benefits from exercise alone. Every period of moderate to strenuous exercise improves insulin sensitivity for about 16 hours. So you can actually reduce your chances of developing type 2 diabetes with regular exercise. There's also a lot of cognitive, mental benefits from regular exercise. It's a great treatment for depression because, as we intimated earlier, depression can be an important factor in erectile dysfunction as well.
What kind of exercise would you recommend? Anaerobic, aerobic, a mixture of the two?
Mixture of the two. I find that finding the right exercise for a particular patient, you need to discuss what they do already, because if somebody's a regular gym goer, then it's easy to adapt their training program. But if it's somebody who's never been to a gym, you might just have to start with regular walking and gradually build it up, so they do walking for at least an hour a day.
So pretty common sense things: staying active, staying fit, making sure you keep your weight down to a healthy weight. What would you recommend for patients that are on a vegetarian or a vegan diet? Would that predispose them potentially to erectile dysfunction or low testosterone?
Well, as long as they're not becoming deficient in certain vitamins, particularly vitamin D, so they should have that checked. If they've got to be having enough protein. But generally speaking, there are probably more benefits to vegan diet as long as you're watching your vitamin supplements to the average English diet, which we know is causing more and more type 2 diabetes year by year, and we keep trying reinventing measures to improve the UK diet every year, and we seem to keep failing regularly.
As long as they're getting enough protein and healthy fats.
And vitamins.
And vitamins. Okay.